Hi everyone, welcome to Lesson 8 of the Human Resource Management in Healthcare course. Okay, so today we are going to look at compensation practices and then planning and challenges. We're going to go through like a strategic way that you can adopt to of how you're going to formulate the compensation packages for your employees. Okay. And then we're going to look at different ways in which compensation and salary is, provided to their employees and like different salary ranges and whatnot. So let's go ahead and dive in. Okay, so the strategic goals of compensation. The whole point of compensation is to reward employee performance, right? And in an organization, you want to try to aim to achieve internal equity, okay? And internal equity in an organization is when there's fairness. There's a lot of fairness in the ways that you compensate your employees. Okay, so what that means would be like, for example, a nurse in one department of a hospital should make just as much money as a nurse in another department of that same hospital, provided that they both have like the same degrees and like the same kind of amount of experience and such. Okay, so that would be that they have that there's fairness, there's internal equity. Okay. Also, compensation allows organizations to compete with other organizations within this industry, especially when it comes to being able to attract and hire high-performing employees. Of course, if you're an organization that pays very well, you're going to attract very high employees, and if you don't pay as well, you're probably not going to attract high-performing employees. In fact, if you don't pay well at all, if you pay very below market, it's highly likely that you're going to experience high turnover. Okay. Also, some of the goals within compensation will be to make sure that you are always complying with legal requirements. You don't want to get in trouble about this kind of thing. All right, so there are 4 different strategies to compensation. All right, these are called the different quartile strategies. In the first edition of the book, they actually only mention the first 3 of the quartile strategies. If you get the second edition, you're going to get all 4. I'm going to test you on the first 3, but I'm not necessarily going to test you on the 4th, although we are definitely going to mention what the 4th is. Okay, so let's go and look at first of all, let's look at the first quartile strategy. Okay, so the first quartile strategy is when an organization chooses to pay below market value. Okay, and there are a variety of reasons why you want to choose to pay below market value. I mean, first of all, you're obviously not going to be spending as much money, but why would you, what circumstances could bring you to that situation? Is it because you're being selfish, or is it because you, as an organization, you don't have the funding to pay very well, to pay competitively? Okay. Sometimes, or like if you're, like let's say the economy is down for a while and maybe the organization isn't making as much money, so you may opt to use the first quartile strategy, so you're going to pay below market rates. Okay, and of course you should know that when you do choose to pay below market rates, more than likely people are going to try to work for you. If it's during a recession, a lot of people are losing their jobs. You as a business, your business isn't doing too well, so you have to pay less. When people come to work for you, I'm sure they will accept the lower pay, but they're also only going to be there for a while until they can find a job that pays a little bit better. Okay, so you're kind of accepting that I'm going to turn this job into like not a destination job if you go down if you pay first quartile strategy, this is not a destination job. The job that you're providing is not a goal. Okay, just know that. But in some organizations and for some certain positions, the first quartile strategy works out great. Like for Amazon workers or Walmart workers, like the floor workers, it's okay to opt for first quartile strategy, below market rates. And the idea behind this is because that particular job is not highly specialized. Okay, the requirements for that job are they're not like difficult to find, really. Okay, so really anyone can do those jobs. Okay, or almost anyone can do those jobs. So if you experience high turnover rates in that business or just for those certain positions, it's okay. It's not really going to hurt the business. If you have to keep retraining, because training isn't that expensive and everything like that, so you can keep turning out employees. You can keep hiring people, and then people are going to leave. And then you hire more people and people leave, and it's okay. It doesn't really affect the business. So in some organizations, this is actually part of their compensation strategy for certain positions. Okay, this works out well for them. Now we're going to look at the second quartile strategy. So this is very basic. This is where you pay whatever market value is for this job. Okay, you just go along with everyone else and just do what everyone else is doing. Okay, so this allows an organization to be somewhat competitive-ish if you offer other perks, but it doesn't hurt the organization at all. You're just paying just as much as any other job out there. So if an employee comes to work for you, they're probably not going to be like, well, I'm going to go over there because they can pay better. They'll probably stay. Okay, because you're paying the same thing that everyone else is paying out there. Okay, so it does help you, get some retention there. Okay. Now the third quartile strategy is when employers decide to pay above market rates. So this is for especially a lot of organizations choose to use third quartile strategy when they're trying to attract high-performing employees. Okay, they're trying to attract highly specialized employees or even like celebrity employees. They're trying to attract they're trying to be very competitive and be able to get, someone like a rock star employee, and so this allows them to be super competitive, and it's also going to definitely attract those employees out there, but this is also going to help them retain a lot of their employees as well. I forgot to talk about fourth quartile. We're going to do that right here before we get into all this. So the fourth quartile strategy pays above 80% of market value. Okay, market value for that job. Yeah, I'm dead serious. 80% above market value for that job. Okay, that's a pretty expensive job. See, the thing is, there are certain situations where that may be what you want to go for. For example, if this particular job is extremely dangerous and a lot of people are not going to want to risk their lives for, market value money, okay, or even slightly above market value money. It's probably not worth it for a lot of people. But if you pay over 80% of the market value of that job, people are probably more than likely gonna be like, oh, okay, well, instead, I'll do it. okay, because it's a lot more money. Also, there could be other reasons for why you would opt to choose the fourth quartile strategy, but really, just if you ever wonder why you might, just think about all the reasons why you might want to pay 80% above market value. Maybe there's a specific employee that you want. Okay, maybe there's just one person out there that you want to do this particular job and they're in high demand. Everyone is making them offers. It could be something like that as well. So anyway, now let's look at job evaluation. Okay, how do we find the monetary value of a job? Okay, how do we figure out exactly what is the monetary value? What is this job really worth? Okay, because that's going to figure out exactly what we should be compensating for these particular jobs that we hire employees to do. One thing that there are numerous different methods we can use to figure out the monetary value of a particular job. And one thing we can do is we can look at benchmark jobs. Okay, so benchmark jobs are these jobs that are just so well understood. They're very, it's part of our culture. We already know what those particular jobs are, what they do, what's involved. We know the monetary value of these jobs. We know the range in which we know what they should be paid. Okay, so those would be benchmark jobs. They're like the obvious jobs what everyone kind of already knows about, right? And then now we have a bunch of other different methods that we can use to figure out the monetary value of different jobs. Okay, so we're going to go ahead and look at all these. So first of all, there are point systems for job evaluation. Okay, and if an organization chooses to do a point system, what they're doing is they're figuring out certain skills and certain valued aspects about a certain job, and they're going to call them compensable factors. So what compensable factors could be, like some examples might be educational requirement, like education levels, certain skills that you have, maybe the autonomy that you're going to bring to the job. Are you in a leadership position? Are you a supervisor? Customer service skills, things like that. So these are compensable factors. These are factors that a person can bring to the table that can be monetized. Okay? So in these compensable factors, they should be measurable as well. So what you do when you use the point system is jobs are going to be assigned certain points on the basis of the relative content of each compensable factor. Okay, so depending on so if each job is going to, so certain jobs are going to require like education, customer service maybe, and other stuff. Maybe you're a supervisor as well. So these are certain compensable factors that job entails that you have to have for that particular job, right? So each of these compensable factors is going to be assigned like a certain amount of points. Okay, and given that all these points are used in the job, what they're going to basically do is just add up those points. Okay, add up the points that you get from those compensable factors, and then the total number of points that each one that that particular job would come out with, that total number of points is going to be associated with like a salary amount or a salary range. Okay, and then that salary range is what is going to be used for that particular job. Okay. Then we have job classification systems. Okay, so this is what the government uses. Okay, the federal government uses this. Other government systems will use this. Okay, it's a job classification system. Basically, they have different grades, or like kind of like different levels of like pay grades. Okay. The federal government has 15 different grades, or 15 different levels, and each like level or pay grade has a salary range. So if you are working for the federal government and you have a certain job, you might enter the government workforce like at a certain pay grade, and then you can move up. And each time you move up, you enter a whole new pay grade. That pay grade is associated with the salary range. Now these salary ranges are actually kind of small. They're not huge ranges. They might be like 1,800 to 2,500, and that's your salary range. So they'll pay you probably at the 1,800 in the beginning, and then you kind of work your way through with experience, and they'll give you raises and such until you hit the 2,500 point. Okay, and then at that point, if whenever you're ready for your raise or anything like that, then it's like you kind of have to jump a pay grade. Okay, so you might get like a whole new job title. Okay, if you're gonna jump a pay grade. So this can kind of be like inefficient in a way, because it relies on your job title. Okay, like your pay grade will rely on your job title. So if you're not able to jump that job title, you might be stuck in that pay grade, or that like small little salary range, until you're able to jump or get a new job title. Okay, so then we have broad banding. Broad banding is that's having a huge salary range, like ginormous, a huge long salary range. Okay, and that way we can kind of move the employee in different areas, and get the employee to be doing different things, having more responsibility, and that way their pay will be a little bit more flexible too. Okay, so we can, if we give the employee more autonomy over their job or more responsibility, we can kind of add more money to them, and they don't have to jump a pay grade. Okay, they don't have to get promoted to another position. They can stay within the same position, and you can just sort of give them more money because it fits within that pay range. Okay, so then we have variable compensation. There are a lot of different types of variable compensation. Okay, so this is when your compensation isn't fixed. It's not like a traditional salary, okay, where your compensation fits into the salary range, and that's your fixed amount of money that you get every month. Variable compensation is variable. It might be different every single month, and it might be based on how many sales you get, how many volume of patients or things that you sell. It might be based on like the quality that you provide or things like that. Okay, so let's look at a couple of these. Commissions. This is usually done in sales. Okay, usually commission is like you can make a percentage off of each item that you sell. In many situations they might have like a base pay plus commission. Okay, so you might make a certain percentage of that sale, or they might say here's a fixed amount per sale that you make, and then that's what you're gonna get. Okay. In healthcare, especially with physicians, we're kind of circling around productivity-focused pay for performance and then quality-focused pay for performance. So productivity-focused pay for performance model, this is where you would pay your physician based on the volume of the patients that they're able to see. So in this instance, a physician might try to see as many patients as they possibly can in a day or in a week or a month or however often it is, and they will be paid based on that. So the more patients they see, the more patients they can see with their time, the more money they're going to make. And this kind of thing may result in physicians not spending much time with their patients, not providing quality service to their patients, not really paying too much attention to what's ailing them, and really focusing on the health of the patient. It might get them to go, they might just spend around 5 minutes or so just kind of like doing whatever, checking boxes, giving a pill, and then moving on to the next one. Okay. Quality focused pay for performance model seems like it would be great, but it also has its flaws. Okay, so quality focused pay for performance model would be where you can kind of measure they usually measure the quality based on how many favorable outcomes you get with each patient. So like if you get positive outcomes with every single patient that you look at, like they get well, they get better, or maybe they were never very sick in the first place, or whatever, then you get paid. Okay, so if you have a positive outcome in a patient, you get paid well, or have an incentive or a bonus or something like that. And if you don't, if a patient might get worse or has some sort of negative outcome per diagnosis, then you don't get paid well for that patient. Okay, so what this may drive a lot of physicians to do when they get paid this way is to focus on taking on the patients that they know are going to be able to have a positive outcome. If they look at a patient and go, that patient is definitely not, I can't win with that patient, I'm not going to be able to cure them or to help them, I'm not going to get a positive outcome out of that patient, maybe that patient doesn't listen to me, or that patient, their condition is just completely, they're deteriorating and there's almost nothing I can do at this point. Many physicians might choose to not take those patients on, okay, and they'll focus more on the ones that they know they can get a positive outcome with, because in that way they're going to get paid more. Okay. This slide basically is going to get deeper into what I pretty much said on the last slide. Okay, some of the problems with the pay for performance programs. This gets into paying physicians based on the number of patients that they take care of. You might see a negative effect in the quality, and then when you pay your patients based on the quality of patient outcomes, that may encourage a physician to only see relatively healthy patients. Okay, so you kind of you might have a negative impact either way. Okay, it might negatively impact the way healthcare is going. So even though I think Medicare right now is trying to find a way in which they can implement a quality focused pay for performance program called value-based reimbursement, but like I said, if they do it in this way where they focus on the patient outcomes, then you could see physicians not wanting to care for those patients that are not relatively healthy. Okay. Okay, so what this slide is it's going to give you an overview of different common physician payment methods. So usually a solo or group practice, they'll probably have contracts with different private insurance agencies, and they might be certified by Medicare, Medicaid. They might have contracts with different managed care organizations, or they could also be working for a managed care organization, in which if they are actual employees, they're probably going to be paid based on a salary. Okay, if they're working with managed care, like on a contract basis, or any other private health insurance agencies, they might be paid based on a fee-for-service schedule, or they might have incentives, or they could also be paid based on capitation. Let me just put that right there. Capitation. Okay. Independent practice associations typically will use incentives and discounted fee-for-service schedules. If it's a staff model like an HMO, as part of like a managed care organization, normally they hire their employees, so you would be working for a salary or paying that physician based on a salary. Okay, hospital-based physicians. There are a variety of different arrangements with hospital-based physicians because some of them are contract workers and some of them are actual employees. So you could be paying them on a salary, you could be paying them on some kind of contractual arrangement, or anything else like that. Then if it's a faculty practice plan, like at a teaching hospital, and the physicians who are actually working there as teachers for the new physicians, they might have a group practice plan that includes faculty of a medical center. It could be salaries, it could be some kind of other contract. You could also work as like a temporary contractual paid physician. Okay, so you're temporarily employed for a while, and at this point you'll probably be paid like a fixed amount for just like that time that you're going to be working for them. Okay, like you've already agreed, I'm going to be working for you for 10 months or whatever, you're going to give me this amount of money. Okay, then we have physician managers, which are usually medical doctors, consultants, administrators, and such. And these guys are going to be employees, so they're going to be working for a salary. Okay, so I hope you guys enjoyed this lesson. And if you have any questions, please leave them in the comments, and I will see you in the next lesson.